Our granddaughter Greta was born premature, 26 weeks. Munson did an awesome job. They saved her life.
Obviously, we were concerned about her well-being and her survival, and she was in the NICU unit at Munson for about a month. It was a very stressful time.
It was very difficult for us to go in and visit because it's just one big room and there were so many other babies in there, and you didn't want to invade somebody else's privacy, and you didn't want to get in the nurses and the doctors' ways. It needs to be replaced.
Munson desperately needs improved facilities for pediatrics, NICU unit, and women's health. And we're used to the best around here, and Munson has given us that in every other area, so now this is an area that needs some desperate improvement.
We have an outstanding clinical team of nurses and staff and physicians and providers, but our facilities have been lagging behind.
Our current facilities really are insufficient to provide the level of care that I think the mothers and infants and children in our community deserve.
A family birth and children's center is critically important as a next step in the advancement of our facilities. So now's the time. We cannot continue in the current situation and really fulfill our mission to this community.
Our unit was developed 20 plus years ago, and at that time it was the state of the art, but things evolved so quickly in neonatal intensive care that it's antiquated.
We have one large room that we have anywhere from 8 to 14 babies in, and our parents come into our unit and they're traumatized. They were expecting this to be the happiest day of their life, and suddenly they're scared.
First few days that I was in the NICU with Greta, it was almost a little overwhelming because you walk in and you have a row of beds, and all these babies have different needs and they're at different gestational ages, and it's very chaotic.
You're sort of on top of the family whose baby's a few feet away from yours. You only have a few inches of space to sit in. You've got screens set up for privacy, but then the family next to you is trying to gain some privacy as well.
Some of these kids may be in the hospital for months, literally, and for that to be their only space is very difficult.
It's stressful for the parents to see not only your child going through what they're going through, but other families going through their ups and downs. And you have to all share that.
Partway through Greta's stay at Munson, she developed some complications. She had to be transferred to DeVos to undergo surgery.
When we arrived at DeVos, I felt like we had jumped back into the 21st century with all the newest technology and with the privacy.
Greta had her own private room there.
I remember taking pictures and saying, this is what Munson needs. Look at this room. It's just perfect for families.
So when I walk through our NICU and I look at these tiny babies and moms and dads huddled around their isolates, and the conditions that they're in, conditions of our staff working, I know it's not okay.
It's complicated and it's technical, and these patients are very fragile. The standards that have been developed over the last decade are single-family rooms that are able to modify the environment specifically for the problems that each baby has.
It's time for us to step up and to make this right.
Our unit is very small, and we are overcrowded much of the time. We opened this unit in 1995. The other hospital in Traverse City, this community hospital, closed at the same time. So that has really impacted our availability. For the last 26 plus years, my heart has been here in maternity. My job is to make sure that everybody has a room, and it's very challenging some days. I hold my breath a lot of days, hoping that somebody doesn't come in labor because I don't have a space for them to come in and have their baby. One of our solutions for our room issue is to have our moms transferred to our sister unit, C3, which is on the 3rd floor. It's not a great experience for the mom to be paraded through the hospital with her new baby. You can just see the disappointment in their face when they get wheeled into those rooms and realize that's where they're going to be spending the rest of their hospital stay. We all feel very strongly we want the best facility, the best experience for our new families.
The children's wing, which we share with other patients, was constructed in the 1920s.
Nothing about these rooms is kid-friendly.
Greta developed a respiratory infection that required hospitalization and was admitted to the pediatric floor at Munson. You feel like you're in the back corner of the hospital. I don't think there was anything in her room geared towards kids at all.
And it was a place where I just couldn't wait to get out. I just wanted Greta to get better so we could get out of there. It's not a comforting or soothing environment for anybody.
We had a parent say, I'm going to go to DeVos because there's not enough room. It just broke my heart because I knew that we really had the capabilities of taking care of the child on our unit. I just want to be able to care for our kids in our community here at home.
These are the most vulnerable patients that we care for, and they require our best.
Munson's current facilities do not match up to the quality of care that our physicians provide.
Children are the most honest, perfect, most beautiful patients there are. They're not taxpayers, they're not voters, and so sometimes they're easy to forget. This is a moral obligation to provide for children, for mothers, for infants, and it will continue to require philanthropic support.
The only thing that I would have changed about Greta's care would be the facility. Without Munson, we wouldn't have Greta. And you would not want life without Greta.
This is something that we need to address. This is something that is urgent, and I know that together we can make this happen.